Well, hello, everybody. Good afternoon. My name is Garrett Schmidt, and I am the managing editor for VBCExhibitHall.com. And I would like to welcome you all to today's live webinar hosted by Healthjump and special guest of Aledade, which we'll talk about in a minute. And it is titled Boost Financial Performance by Improving Patient Outcomes. And I'm excited to hear from these folks today. And I got a little sneak peek when we did our run through. So I think there's a lot of great information here for you today. A few items of note before we get started. This is a typical, traditional webinar format. So you don't need to worry about muting your microphones or your camera or anything like that. We can't see you or hear you, but we do want to hear from you. So we're going to have a Q&A session toward the end where we'll go through as many questions as we can in the allotted time. So if you have a question, there is you have an attendee module and there's a little area for questions there. So it's different than the chat. So go ahead and submit your question at any time. You don't need to wait until the Q&A to do that. So anytime you have a question, go ahead and submit it. And we're going to get to as many of as we can. If we don't get to yours, someone will reach out via email afterwards, and we'll make sure to answer your question. So even if we're wrapping up, go ahead and ask your question. And then finally, today's session is being recorded. So what's going to happen is when we're done, maybe an hour or two after the presentation, I'm going to send out a link to everyone who's registered, and you'll have a link to the recording as well as to a place where you can download the slides and some other information so that you'll be able to contact the team. And so without further ado, I want to introduce our two speakers today. We have Laura Stewart, who is the Director of Product Delivery, and Jonathan Evans, and she'll go into, I guess, a little bit more about herself. And I guess that's a picture of her car down there. And then Jonathan Evans, who is the Customer Success Manager. So welcome, y'all, and I'll be back during the Q&A.
Great. Thanks, Garrett. Good afternoon, everyone. Thank you so much for attending the session today. Like Garrett said, I'm Laura Stewart. I'm the director over our product delivery group at Cerner, which comprises of our engineers and our customer success managers that take care of our customers through data onboarding and support through the life cycle of their integrations they have live with Healthjump. I joined Healthjump in 2022, and collectively my team manages over 1,000 active integrations every day and growing. Prior to that, I spent a lot of years in healthcare data at Cerner and led a large services team there in the data and engineering service space. In my spare time, I love to work on cars. My husband and I have a hobby commercial garage in downtown Kansas City, and we currently are working on 3 vintage cars. So a little bit about me. I'll let Jonathan share a little about himself.
Yes, hi, I'm Jonathan Evans, and I am a customer success manager with Healthjump, and I work on Laura's team. A little bit about myself. I've been working in healthcare technology for about 6 years with a company called Cerner. I co-championed the implementation and execution of the largest completely integrated healthcare record for our veterans. I joined Healthjump in 2022, and in my free time, I love to wake surf, cook, and work out. I also dabble in a little bit of photography there. So it's a little bit about myself. And I just want to thank Garrett again for introducing us, and thank you to everyone for joining us today. In today's presentation, we will cover Aledade and Healthjump's partnership to create and plan for utilizing people, process, and technology to generate successful engagements. We will touch on how Healthjump and Aledade collaborate together to ensure data quality control and upcoming trends and challenges both organizations may face in the near and distant future. As Aledade CSM, I work in conjunction with Aledade as a liaison between both of our organizations, ensuring new implementations, post-production issue resolution, and organizational relationships are successful. Unfortunately, Aledade had a conflict today and cannot join us, But let me start off by telling you a little bit about Aledade as an organization. Aledade is the nation's largest network of independent primary care practices. For 2023, they added 450 primary care practices, including nearly 60 health centers. They cover 45 states, work with about 1,500 practices, and they have around 150 VPC contracts and cover over 1.7 million attributed patients. Data-wise, they require 90 plus EHR and PM systems to power their reporting and software needs that use for their practices in other health centers. Healthjump serves as one of Aledade's data partners, and we connect to the PM and EHR systems and practice management and clinical data for use in Aledade's applications. We connect to practices and health centers using the Healthjump agent and extract data daily. And the process for that will be covered in a little bit more detail later in the presentation. Before we get started on the people, process, and technology insights, we have a few polling questions for you today. How long does it take you to onboard a new customer today?
Okay, I put the question up, so we're going to wait for some answers to come in.
And onboarding includes practice connectivity to the database, data extraction, QC training, the practice on the software, and things of that nature.
Give it a couple more seconds here. 5, 4, 3, 2, and 1. All right, I think we got all the answers in, so I'm going to go ahead and put up the results. Are you able to see that, Jonathan?
Yeah, so it says 44% are not applicable, about 25% are 50 plus, 30 to 35 days, 0%, 15 to 30 days, 13%, and under 15 days, 19%. In the industry that most of us are in today, the length of time of the implementation has a direct correlation to our value proposition of our organizations. Healthjump and Aledade strive to get a practice fully onboarded, meaning data flowing, within about 30 days of them joining Aledade. We will walk through this and how this is done in consecutive slides. As we go into the next segment, we will discuss how Healthjump and Aledade reduces implementation times of our organization. The implementation process starts with Aledade's integration team. Once the requisite steps are completed, the Healthjump engagement to extract their data for the Aledade application begins. First, the practice gets assigned to a sprint to begin data extraction. Once the raw data is extracted, it gets put through both Healthjump and Aledade's quality control processes. When the data passes its quality control stage, the practice is considered live and data becomes available within the Aledade application. Once a practice is live, it is then transferred to post-production support teams, managing in collaboration both between Healthjump and Aledade. And this ensures that all data is working and flowing as designed and that all connections are green. Now that we have discussed our processes at a high level from signing to Aledade to post-prod support, let's discuss how this process has impacted organizations in 2022. A few points I want to highlight here is that in the time to go live has decreased. In 2021, we had 283 average days to take a practice live. And in 2022, last year, we have averaged about 74 days. The total projects that we worked on for Aledade were 148 completed. And in 2022, there were over 221 projects completed. Please note the above timelines are from contract signature to join the ACO to go live on Aledade solutions. This includes connecting to the database, extraction of data, quality control checks, Aledade onboarding into their platform, practice training, and things of that nature. Even though the number of total projects completed in 2022 increased by 73, Through our collaborative efforts with Aledade to make our processes more efficient, we were able to decrease our time to go live by 209 days. Our goal in 2023 is to reduce that time to 30 days. The reduction in timeline and increased implementations completed can be attributed to a few key points. And one, increasing inter-organizational planning. So Aledade and Healthjump devised a plan to work through a 1-week sprint where work from all work streams are triaged appropriately for prioritization. Previously, we had work between all work streams, new implementations, clinical team, and post-production support competing for priority. Now that we have a triage process and a prioritization plan, this issue does not occur. We also improved the resource management. Both organizations have worked to use their human capital more efficiently to improve throughput for implementations and issue resolution. This has been a big change for us. Improves communication and access between organizations. We have multiple touch bases between our two organizations. 2 for new implementations, 2 for post-production report, and 1 end of the week wrap up. Additionally, we have a real-time communication methods for escalations and where there isn't any communication lag. And this has proven to be very successful for us to ensure that both teams are aligned. Next, we will go to Ronnie Crozier, Director of Implementation at Aledade, who will share her thoughts.
Our projects are mostly grouped by installation phase and development phase. Both teams dedicate resources on these phases. Then the PM from each team has an oversight of all the phases. The collaboration and open communication between all team members contributes to the success of our mutual projects.
Aledade also spends quite a bit of time cultivating personal relationships with each practice during the onboarding process. Ronnie's also going to share how they organize that across their various teams internally at Aledade.
Its implementation team manages direct practice relationship during the onboarding process in partnership with our field team. The implementation team works closely with our practices and guides them through the onboarding process. The goal is as seamless and minimum lift as possible for our practices so they can continue focusing on patient care while we work on onboarding them into our ACO. Its implementation team manages direct.
And lastly, as Jonathan kind of explained, we also do a lot of interaction between our two teams. And Ronnie's going to share a little bit from her perspective and how that works.
From the Jump agent installation, Healthjump made available a calendar link where our practices can schedule the installation at the time that is most convenient for them. During the installation, a Healthjump resource guides the practice's resource on a step-by-step to perform the installation. During this install call, the practice will inform the Healthjump resource on the best time when daily data pulls should be performed at. From the project management perspective, a project manager from my side partners with a project manager from the Healthjump side. They meet weekly towards the end of the week to decide on the scope of integration for the next week. My team meets with the Healthjump team twice a week to review the progress of projects in scope for the week and discuss any barriers that need to be addressed.
Outside of the project coordination and building and leveraging relationships, Healthjump utilizes our technology to organize the work. We have what we call our Healthjump app, where all of our customers order new connections or integrations to start the data extraction sending process. This allows our customer, when they're ready, to tell us that a new connection is on deck, where they will come into the app, select the EHR practice management system that they would like to integrate with, give us a few details about the practice, and then select the quality control playlist that they would like to run against the data, something we'll dive deeper into here in a bit. From there, they are able to see the next steps in terms of what needs to happen to get connectivity to the EHR or practice management system. That could include installing the Healthjump agent, where they will receive a link to send to the practice contacts, where they can schedule a time that works best from them and get on a quick 30-minute phone call with our system engineer to complete that installation process. Or it could be instructions on how to access or approve API keys to send to Healthjump so that we can start an API extraction process. It varies from system to system, but the application and the Healthjump app walks the customer through the next steps that need to take place so that we have minimal time spent from a practice resource perspective. Our goal is always to have as minimal touch as possible so that they can focus on patient care. Once Healthjump receives access to the data, that's when the extraction process starts. So Healthjump will get connected and then schedule our standard extract scripts to run against that system. So we have over 60 systems out of the box that we support, where it's plug play, and we install our standards, extract the data, and then that data will flow to our AWS data warehouse, which is Redshift. And that's the point when we run our quality control scripts to either find any adjustments that need to be made with the extracts. So maybe the practice has a different workflow for recording blood pressures, for example, that we need to adjust the scripts and or inform our customer of any data dirtiness that they should be aware of. Once we walk through that process, then we serve the data up for data delivery, which we make available to our customers via webhooks, the Healthjump API, or a nightly flat file delivery. We also provide what we call DBX, which is a data exploration tool that sits on top of Redshift, where our customers can write ad hoc SQL queries if they're testing things before data ingestion or looking at support problems, and save them to rerun in any given future time. So once the data is in-house, from a data extraction perspective, on all new connections, Healthjump works with our customers to run what we call our quality control playlist. We start with our customers with our standard boilerplate playlists and then adjust them from there. So we really feel that QA is the key to making insightful decisions in terms of powering software. And we want to make sure that the data that our customers take to put into their software to show physicians' care gap areas, to-do lists for patients coming in the door that day, et cetera, it needs to be as accurate as possible, so they're making good decisions and taking care of patients appropriately. So here's an example of some of our QA scripts. So we're really looking for two things here. One is the data extract correct and complete, and two, are there any anomalies that our customers should know about? And then we make adjustments and add additional scripts as needed with our customers. So if there are certain fields on or columns on tables that our customers absolutely need populated every time or need to know about when they're not populated, we can write scripts for that to show the percentages of encounters that maybe don't have a blood pressure, for example, or trends of, they did, 500 flu shots last December, but this December they did a lot less, or things like that. So it's very flexible. The output of the quality control is available in the app, where our customers can see what passed and failed and any comments our engineers made while they completed the QC process. That allows quick and easy data management. You can get back to it. You can see the historical results easily and kind of take care of it from there. And we also, with Aledade, have built a kind of special spreadsheet we also populate for them that shows a lot of trends in terms of percentages of things that are present or not present within specific data. What I'm showing here is an example of the demographic output for a connection, where they're looking for invalid characters in names or duplicate SSNs where maybe someone's typed in all ones, etc., that have impact to their software and importing data into their software solution. So we really believe our quality control process really helps in terms of getting the right data to the right place at the right time. And a lot of people that I've just seen historically through various roles that have been in healthcare in the last 13 years looking at data struggle with this. So as you are building connections or evaluating vendors to do this on your behalf, really you want to ask some key questions because it's going to make or break the end product and the user experience and ultimately the patient quality as well. So the questions you might want to ask are, does the vendor have a plan for validating data pre the go live of the connection? How are they going to normalize the data? Both from a structural and semantic standpoint, are you going to get the same file format regardless of the system that vendor's connecting to? How are they going to let you know or inform you of potential bad data that is in the database that they're extracting from? Once the connection goes live, how are you going to know if there's a problem and what you need to do to resolve it, and what kind of monitoring do they proactively provide to you from a managed service perspective? What do you own versus what do they own? Those are definitely things you want to think through and things that we work with Aledade to solve every day in terms of solutions and services that Healthjump provides to make them successful during their journey. Next up, we're going to have Ronnie talk about how the software that they use Healthjump data to power makes it easier for physicians to manage their patient loads and know what to do on patients as they come into the door.
Aledade practices use the Aledade application to improve patient outcomes. Data provided in the Aledade application is an aggregation of scheduling, claims, and clinical data that Healthjump extracted from the source systems.
Once the application is live from an Aledade perspective, Healthjump works with Aledade daily to do proactive post-go live support. This includes proactive monitoring of all live connections that Healthjump completes every day for our customers, where we are looking for errors in data extraction, integrations going down, etc., and bringing things back up before our customers ever know that there's a problem. In the event that the customer needs to work with the practice to facilitate a resolution, Healthjump will open up a ticket in the Healthjump app where our customers can see all open tickets, what's up, what's down, etc., like in the view that's on the left here on the slide. And that allows them to easily manage what they need to do in terms of taking care of any problem connections to get the data flowing again, so Healthjump can continue to send data and make use of data from a customer perspective. We also have additional views that will show load statuses into our data warehouse, so you know when things might still be loading or things didn't load all the way. And then some data warehouse views as well, so people can easily see how many new rows were committed or updated or modified in any given day. to help kind of manage the big data flow that might be flowing through the data pipelines that Healthjump is sending to our customers. And now we're on to our next polling question.
All right, it is up for everyone to answer. Okay, we'll give it a few more seconds here. Maybe 5, 4, 3, 2. We still got a bunch of answers coming in here. 3, 2, 1. Okay, I think that is enough. So I'm going to go ahead and close this one out, and then I'll show the results. Okay, Jonathan, are you able to see that?
Yes. So the question was, what are you most worried about in solving in 2023? And it looks as if 23% of you said equity, data. 8% said structural normalization of data. 15% said semantic normalization of data to industry codes. 38% said getting actionable insights in front of physicians, and 15% of you guys said other.
Okay, great. I'm going to go ahead and pull it back down.
Great. Thanks so much for sharing your insights. I think we see a lot of Healthjump's customers stay up at night worrying about the same things, many of which we try to solve for our customers so that they don't have to worry about how am I going to get the new social determinants of health data, or how am I going to make sure that all the data looks the same, etc. Ronnie's going to give a few oversights on, from her perspective, some of the things that they worry about as well. And then we can talk a little bit more in depth around some trends that we're seeing coming up next.
Given Aledade's nationwide footprint, the biggest challenge for my team in the integration space is integrating with many practice management, electronic health system, billing system, etc. We potentially work with over 100 combination of software and hosting systems. That's when Healthjump comes in. It helps us with roughly 25 to 30% of them, depending on the year, because it is difficult to know what system these practices will use, mostly not until after they sign a contract with Aledade.
So from a Healthjump perspective, like I said, we try to solve a lot of that for the customers. So whether it's you don't know who your next customer is going to be, or next practice is going to be that signs up, we try to continue to build our data integration library on our working on another 60 plus systems in 2023 in terms of adding to it based on our customers' demand. So regardless of what you need data out of, we will go and do that work to get that data for you. Whether it's all the moving parts and pieces from an industry perspective in terms of social determinants of health ads, USCDI, fire specification, etc. Healthjump works to support that, so you don't have to worry about the technology pieces of it, so that you can be successful. We continue to see a lot of demands in terms of data, and those demands growing. I don't think that's going to stop in the near future or even in the midterm or long term. And that's why we're here in terms of being able to connect and send data and do so efficiently. So some of the things you definitely want to think about as you build your data strategy as an organization from 2023 forward. The amount of data and the type of data that you might need is going to change over time as well. And lastly, we've got a couple other insights from Ronnie in terms of our partnership with Aledade that she would like to share as closing thoughts since she couldn't be here with us today. And then we'll have plenty of time to do Q&A and help answer any questions you might have in building your data strategy to improve patient outcomes.
Healthjump's competitive advantages from my point of view are the number of systems they can already integrate with and affordable integration cost. The predictability of when most of our projects will be completed is why we made the right decision on this partnership. Healthjump's competitive advantages from my point of view are the number of systems they can already integrate with and affordable integration cost. The predictability of when most of our projects will be completed is why we made the right decision on this partnership. I think it will make integration projects for many of them very easy to accomplish. And the one thing that I'd like folks to know about Healthjump is definitely predictability at an affordable cost.
Yep. And lastly, she's got one last insight here she would love to share with you.
The minimum lift on the Aledade side, and most importantly on the practices side, is also great value added for Healthjump. In most cases, existing scripts that the Healthjump team developed for various systems can be used across the board, which helps to create a more predictable turnaround time on when we can expect to begin receiving data once the JUMP agent has been installed at the practice's environment.
Great. I think we're at the point of Q&A, so I'm going to turn it back over to Garrett to help facilitate.
Okay. All right, great. Yeah, well, we did. There's a lot here, obviously, and thank you guys for this. Is a wonderful presentation. We did have a bunch of questions that came in, so we will go ahead and jump into these in no particular order. If you do have a question that you'd like to submit, if you missed the first little explanation of that, you have an attendee control module. So please submit your question there and under the little questions area, and then we're going to get to as many as we can. If we don't get to yours, we'll make sure to reach out via email and answer your question. There you are, Laura. We've lost you for a second. Okay, first question here is, can you please expand on the initial information sent to a practice regarding patient extraction?
Sure, we'd love to help answer that. So we work with our customers to kind of arm them with a packet of information that they can send to practices. In many cases, a lot of our ACO customers have field reps that kind of own that relationship, or account reps that do that physician liaison with both the physician and IT teams. And so we'll send them information on what is the Healthjump agent, how does the extract process work, what does the security look like, which is what a lot of people have questions on in terms of how secure is it, and what certifications do you have, those types of things to help calm any fears or answer any questions. And then from there, typically that is enough for a practice to feel okay with moving forward in terms of database connectivity. And then we just walk them through the right steps based on the system they're connecting to for them to start the integration process with Healthjump.
Very good. All right. Next question here. Let's see. Is I see Healthjump is a NCQA DAV certified. What does that mean to data quality?
Sure. Great question. Healthjump went through NCQA's DAV certification program last July and received certification in December. What that means is that NCQA and their third-party data assessor has certified several systems of Healthjump does extracts from for data quality, and it's kind of an intensive 6-month cycle that includes both process and technical review, along with primary source validation, like any other HEDIS audits you might go through to ensure that the data extracted also meets the data on the front end. We already felt very confident that our data was high quality, and the certification just kind of shows it. It also allows our customers, if they would like, to use Healthjump for insurance submission, that they can use our systems that we've got DAB certified and not have to do post-submission audits with insurance companies or health plans.
Okay, wonderful. All right, moving right along. Next question is, if there is a system you don't currently integrate with, what is the process to connect with that system?
Sure, great question. And one we get somewhat frequently. We support all of the major systems out of the box that you probably have 80% or more of your practices and health facilities using, but there are still hundreds of certified EMRs out in the marketplace that people are using. A lot of them are niche and specialty-based solutions. And Healthjump's kind of guarantee to our customers is if you can get us access, we'll do the due diligence to complete, extraction and re-add it to our library for everybody else to use as a customer as well. So if there's a new system that you don't see on the Healthjump integrated supporter list, there's a process to kind of notify your CSM, and then we work to get in on our delivery schedule to go do that work, and we'll give you a time frame of when that will be completed. Once the work starts, it's around 60 to 90 days to actually do the development, go through QC, and turn it live for the first connection you might have.
Okay, great. Next question here is kind of maybe a follow on. Can you connect with Epic?
We can. We've got several customers that use Epic today that we connect to and pull data for.
Okay, wonderful. All right, next question is kind of a multi-part question, so I'm going to ask it in pieces here. First of all is, how long are your sprints and how many practices are prioritized per sprint?
So I can start.
Yep.
I can answer that question. So the sprints with Aledade are on a week-by-week basis, and through our multiple meetings and our collaboration, the prioritization of those practices are kind of discussed. So if you remember what I said before, that we have, they have different work streams between post-prod and the clinical team and questions they have from that team, and then also new integrations. So we can do up to 8 or more, but depending on the workload and what comes in as we prioritize and triage, that can be less, just depending on what comes through. So if we have all new practices, so we'll do about 8 in a week.
Okay, very good. And then next question here is about the same asker, is what data format are you outputting? In parentheses, I'm assuming you're doing direct database inserts.
So when we pull data extracts, we're pulling that data and normalizing it from a structural normalization into our Healthjump spec. From an output perspective, we can deliver a flat file every night that a customer consumes. We also have our Healthjump APIs that return data as well in a JSON format. So just from a file output, if you go to support.healthjump.com, we have our specs on our website where you can kind of see what's included for each table and what that output would look like. from a individual perspective. We also have a sandbox if you're a developer want to go play and call our APIs and see what that looks like on your end. And we have flat files out there as well from a sample perspective that you can play with too.
Okay. And then the final question is, again, by the same asker, is you mentioned some sort of agent. Do you get pushback or fees from hosting companies to install or monitor the agent?
That's a good question. Some of that is definitely dependent on existing contracts the practice might have. In most cases, we don't have additional fees that are charged to a practice. Healthjump has worked to build a lot of relationships with the various hosting companies, et cetera, so that there isn't necessarily anything extra. They're used to seeing us, they know what to do. And we kind of go on our way. It's very rare that there would be additional fees, and we try to keep it that way. We want our integrations to be affordable and non-impactful to the practice from an IT budget perspective.
Yeah, great. Okay. Next question here is, how do your algorithms tie to CMS MIPS SOC guidelines and quality measures? And then the follow on is, what's the average MIPS score for the practices on your system?
Yeah, that's probably something that we can follow up with you on. Healthjump's platform doesn't do the MIPS score calculations. We provide the data that would make up all of the various measures that a practice might be reporting on. But we'll take that as a to-do to follow up with Ronnie to see if Aledade can answer that, because I think that's probably more of a question on their end.
Yeah, sure. Next question here is, how do you measure improvements in patient outcomes? Does it include patient-reported outcomes? Patient-reported outcomes.
From an Aledade perspective, yeah, it does. They've got a fabulous website that I encourage you guys to go to if you haven't been out there before, where they have quite a few podcasts and articles that they publish on a regular basis that talks through their measurement of quality and outcomes, that they power through the data and through their Aledade application.
Great. Next question here is, let's see, how does your platform tie with RCM and claims generation to optimize HCCs?
Sure. So Healthjump does support charge and transaction models where we get data for that. We also support diagnosis and problems in terms of pulling that data as well. So most of our customers will take that, and that's where they're using insights on their end and the software that they're using to power, enhanced, rev cycle improvement and HCCs on their end.
Wonderful. Okay, next question here is, I'm surprised that Aledade can sign a customer without knowing what source systems are used by the practice. Can you comment on how the process works if the source system is not supported and how often that might happen? That may be more of an Aledade question.
Yeah, I think Healthjump can probably comment on part of that. And I would say I would commonly see this too sometimes in informal life too. With large organizations, sometimes when you're signing a lot of contracts, you don't know necessarily what the sales end is doing versus what needs to happen on the technical side. And so sometimes that gets missed or doesn't, get, liaisoned on over because people are out there, meeting targets and quotas and trying to sign people up, knowing that the tech team will figure it out on the back end. So I would say, it does happen with our customers. Where they do have folks that are in the field that are signing people up that they don't necessarily have a plan to get the data out because it's not a system that Healthjump supports. And that's where we kind of work through adding that to our new system list. So as long as the practice and our customer are willing to be kind of that testing partner with us, Healthjump will do the work to create that integration. Once we start that work, it is typically 60 to 90 days from front to back. That includes data extractions, QC, writing, data transformations to the Healthjump's standard schema, et cetera. And then once it's live, it's ready for rinse, repeat, reusability across all of Healthjump's customers.
Great. Okay. Our final question here, which is actually a good one to end on, is what is the process of submitting an RFP?
Sure. If you go to healthjump.com, we have a submission form. That's how you can get a hold of us from a sales perspective, and someone will reach out to you to work through that submission. We'd love to see them, so send them our way.
Yeah, and as a follow along, if you needed to reach out to me, if you were confused about the process, I'm happy to connect you as well to the team. So, but that is actually our final question. So we're going to wrap it up here. Wanted to thank everyone for joining, and Jonathan and Laura, thank you so much for this this presentation. As we close out, I wanted to encourage you all to visit VBC Exhibit Hall and check out the Healthjump virtual exhibit booth. And this is a really cool way to see what they're doing, to interact with their team, kind of a snapshot of what they've got going on in the value-based care space. And there's just a lot of materials and resources there. Also, in the future, if you're ever trying to find this webinar, I'm going to send you a link to it, but we will be storing and housing the webinar in our library archive. So you can look in our VBC Exhibit Hall library under webinars in the categories, and you'll be able to find it there along with a lot of other similar presentations. So with that, as a final thought, if you wanted to reach out to the Healthjump team or would like to contact them directly, you can, Laura, can I get you to go to the final slide there?
Yep.
There we go. You can reach them at www.healthjump.com. And of course, again, I'm happy to connect you as well. So feel free to reach out to me as well. But thank you all so much for coming. Really appreciate your time this afternoon. Jonathan and Laura, again, thank you for your time today.
Thank you, Garrett.
Thank you for having us.
Right, have a great one, everybody. Bye-bye.